Diabetes treatment. Any successful method of diabetes treatment should aim at removal of the actual cause of the disease and building up the whole health level of the patient. Diet plays a vital role in such a treatment. The primary dietary consideration for a diabetic patient is that he should be a strict lacto-vegetarian and take a low-calorie, low-fat, alkaline diet of high-quality natural foods. Fruits, nuts and vegetables, whole meal bread and dairy products form a good diet for the diabetic. These foods are best eaten in a dry condition as possible to ensure through salivation during the first part of the process of digestion. Cooked starchy food should be avoided as in the process of cooking the cellulose envelopes of the starch granules burst and consequently the starch is far too easily absorbed in the system. The excess absorbed has to got rid of by the kidneys and appears as sugar in the urine. With raw starchy foods, however, the saliva and digestive juices in the small intestine regulate the quantities required to be changed into sugar for body's needs. The unused and undigested portion of the raw starchy foods does not become injurious to the system as it does not readily ferment. The diabetic should not afraid to eat fresh fruits and vegetables which contain sugar and starch. Fresh fruits contain sugar fructose which does not need insulin for its metabolism and is well tolerated by diabetics. Fats and oil should be taken sparingly for they are apt to the lower the tolerance for proteins and starches. Emphasis should be on raw foods as they stimulate and increase insulin production. For protein, homemade cottage cheese, various forms of the sourced milk and nuts are the best. The patient should avoid overeating and take 4 or 5 small meals a day rather than 3 large ones. The following diet should be served as a guideline. Upon rising, a glass of lukewarm water with fresh squeezed lemon juice. Breakfast, any fresh fruit with the exception of bananas, soaked prunes, a small quantity of wholemeal bread with butter and fresh milk. Lunch, steamed or lightly cooked green vegetables such as cauliflower, cabbage, tomatoes, spinach, turnip, asparagus, mushrooms, 2 or 3 whole wheat chapatis according to appetite and a glass of buttermilk or curd. Mid-afternoon, a glass of fresh fruit or vegetable juice. Dinner, a large bowl of salad made up of all the raw vegetables in the season. The salad may be followed by a hot course if desired and fresh homemade cottage cheese. Bedtime snack, a glass of fresh milk. Flesh foods find no place in this regimen, for they increase the toxemic condition underlying the diabetic state and reduce the sugar tolerance. On the other hand, a non-stimulating vegetarian diet, especially one made up of raw foods, promotes and increases sugar tolerance. Celery, cucumber, string beans, onion and garlic are especially beneficial. String bean pot tea is an excellent natural substitute for insulin and highly beneficial in diabetes. The skin of the pods of green beans are extremely rich in silica and certain hormone substances which are closely related to insulin. 1 cup of string bean tea is equal to 1 unit of insulin. Cucumbers contain a hormone needed by the cells of the pancreas for producing insulin. Onion and garlic have proved beneficial in reducing blood sugars in diabetes. Recent scientific investigations have established that bitter gourd is highly beneficial in the treatment of diabetes. It contains an insulin-like principle known as plant insulin, which has been found effective in lowering the blood and urine sugar levels. It should therefore be included liberally in the diet of the diabetic. For better results, the diabetic should take the juice of about 4 or 5 fruits every morning on empty stomach. The seeds of bitter gourd can be added to the food in a powdered form. Diabetics can also use bitter gourd in the form of decoction by boiling the pieces in water or in the form of dry powder. Another effective home remedy is jambul fruit, known as jamun in the vernacular. It is regarded in traditional medicine as a specific against diabetes because of its effect on the pancreas. The fruit as such, the seeds and the fruit juice are useful in the treatment of this disease. The seeds contain a glucoside jambolin, which is believed to have power to check the pathological conversion of starch into sugar in cases of increased production of glucose. They should be dried and powdered. The powder should be taken mixed in milk, curd or water. The patient should avoid tea, coffee, cocoa because of their adverse influence on the digestive tract. Other foods which should be avoided are white bread, white flour products, sugar, tinned fruits, sweet, chocolates, pastries, pies, puddings, refined cereals, and alcoholic drinks. The most important nutrient in the treatment of diabetes is manganese, which is vital in the production of natural insulin. It is found in citrus fruits, in the outer covering of nuts, grains, and in the green leaves of edible plants. Other nutrients of the special value are zinc, B complex vitamins, and polyunsaturated fatty acids. Exercise is also an important factor in the treatment of diabetes. Light games, jogging, and swimming are recommended. Yogic asanas such as Bhujangasana, Shalbhasana, Dhanurasana, Paschimottanasana, Sarvangasana, Halasana, Ardhamatasya Asana, and Shavasana. Yogic kriyas like Jalneti, Kunjal, and Pranayam such as Kapalbhati, Anulom Vilom, and Ujjayi are highly beneficial. Hydrotherapy and colonic irrigation form a very important part of the treatment. The colon should be thoroughly cleansed every second day or so until the bowel discharge assumes normal characteristics. Bathing in cold water greatly increases the circulation and enhances the capacity of the muscles to utilize sugar. The diabetic patient should eliminate minor worries from his daily life. The patient must endeavor to be more easygoing and should not get unduly worked up by the stress and strain of life.